class. Today we're going to learn about introduction of hygienic and sanitation. And we're going to look at our learning outcome. Number one, we're going to look at definition. And number two, we're going to briefly describe the history of hygiene and environmental health and its development. Okay, we're going to define the term hygiene, and we can say that hygiene generally refers to the set of practices and objectives associated with preservation of health and healthy living. So that is one of the definitions that you can give to hygiene. And another definition, we can say that it is safe from danger. Safe, being safe from danger. And when we talk of danger, in food, we cannot separate hygiene of food because it is part and parcel. We have to be very careful, especially those who are trained to work in hotels. Remember, those are public areas. There are those people who are very, very sensitive. Our next definition is sanitation, means the prevention of human contact with waste for hygienic purposes. It also means promotion of health, the prevention of human contact with hazard, associated with lack of healthy food, clean water, and healthy housing. So our other definition is okay. For now, let us look at this definition. Let us look at the difference between types of sanitation relating to particular situations such as we have basic sanitation. This refers to the management of human feces, household level. It means accessing to toilets and latrines. Then we have on-site sanitation, the collection and treatment of waste at the place where it is deposited. We also have food sanitation. This refers to the measures for ensuring food safety. Food hygiene is similar to food sanitation. We also have environmental sanitation, which is the control of environmental factors that form link in diseases transmission. We also have housing sanitation, which refers to safeguarding the house environment, the building, and its immediate environment. Then we have biological sanitation, the concept of recycling the nutrients from human and animal waste to the environment. So we're going to look at historical perspective of hygiene and environmental health. And we say hygiene and sanitation have long history at various levels of human civilization. We can roughly divide the history event into two: periodic, the ancient, and the modern. So for the periodic ancient civilization, religious laws such as Moses' law, writing in the Old Testament, and law in the Quran played major roles in the lives of ancient people. These laws mainly concentrated on provision of personal hygiene, dead bodies, and contaminated services, one to be unclean or unhygienic to touch. Then the importance of hygiene and sanitation is to flourish at the times of Greek, Roman, and Egyptian civilization. The use of private and public baths and latrine, cleaning of the body, shaving the heads for protection for the rise infection, and the construction of water pipes and sewage dishes are widely served. So, a number of discoveries in the 19th century were important events for the understanding of communicable diseases. For example, the link between contaminated water and cholera was discovered by John Snow in 1854. The importance of hygienic hand washing before attending delivery baby was noted by Samuelish in 1845, and the discovery of microorganisms. These are very small organisms only visible under a microscope, but they cause diseases. And then the period following the Industrial Revolution in Europe in 19th century showed that improvement and sanitation, water supply, reduce the occurrence of communicable diseases. So the term environmental health is used to describe human health in relation to environmental factors such as environmental health, and which can be defined as the control of all the factors in personal physical environment that have or can have damaging effect on physical, mental, or social well-being. The issues of environmental health is now a global matter under the guidance of the UN United Nations, the World Health Organization. Although hygienic infection factor in environment health, it is good to be aware of the emerging diseases and emerging global warming.